Now, the next thing I want to talk about are arthrokinematics a little bit as it relates to having some stretch of the capsule. So we alluded to this a little bit earlier, but when I move my shoulder joint, and this is going into extension, so I'm descending into the bottom of the dip, one of the things that happens is you have a roll and a glide within the joint. So when I descend into the bottom of the dip, one of the things that happens is when I extend the shoulder joint forces are going anteriorly or forward. Now, normally in the shoulder joint, the capsule is going to tighten it and the ball actually moves posteriorly when you go into extension, but the forces are more anteriorly directed. All right. Now, normally the capsule is going to check this motion. If you have a lot of looseness within the shoulder joint, it's going to move forward more so. And what is that going to do? Besides stretching and potentially irritating the front part of the capsule, it might end up irritating, let's say, the biceps tendon or the subscapularis or any number of the structures that are in the front of the shoulder joint that are being stressed to a large degree because your capsule is no longer functioning the way it should be. Okay. Now, obviously, this is not necessarily a good position to be in, right? So the other thing is that if you have a lot of looseness in the capsule, but you have a lot of tightness in the musculature, then getting an anterior glide of the shoulder might be the path of least resistance. So if you're trying to get into a deep dip position and you have so much tightness from some of the soft tissue structures, we may move more through that capsule. All right. So this again shows you how important it is to have adequate range of motion in the soft tissue structures, okay, like the delt, like the pecs. Okay, and then if we don't have that, we potentially stress the capsule. All right, and the other thing is if I'm weak, and we see this all the time in the bottom of a dip, if I have an athlete that's weak in a dip and cannot drive out of the bottom of the hole just because they don't have the strength in the triceps and the deltoids and the pecs, what they'll do a lot of times is they'll rely on the front portion of the shoulder in order to brace and get stability in the bottom of the dip, and then they'll reverse the motion by extending the thoracic spine forcefully, right? Kind of looks like a dolphin kick. And then what ends up happening is that we're stressing the front portion of the shoulder joint because we're lacking strength and stability. Obviously, this becomes an important player when we have fatigue in the mix. So once I fatigue all my dynamic stabilizers, I'm trying to do more and more repetitions, it makes sense that I'm probably taking more of the stress onto the capsule than I was at the beginning of the set or the beginning of a workout. Okay, so the reason why this is all important is because if we were relying more on our capsule for strength and stability, and we're putting stress on the capsule, this can lead to laxity over time. So over time, we stretch the capsule forcefully, we may potentially be causing some looseness within the shoulder joint, right? Now, if we go back to the dips are already creating a strong anterior tug from the deltoid, and the pectoral fibers are pulling that ball forward in the socket, all right? So if this is occurring naturally and we don't have good rotator cuff support, the cuff is not strong enough to check this motion, then what we have is even more anterior pull, right? Now, if you take a cuff that's already weak or it's fatigue, this worsens the situation. No longer do we have that same anterior support, and the ball is potentially moving forward more, right? And now we have unchecked motion, we have a lot of repetitions, we have fatigue. If we throw in increased load or too much total volume into the picture, we might end up with some shoulder pain. And maybe this is coming from the capsule, maybe this is coming from the biceps, which is in the front, and maybe this is coming from the subscapularis. A little interesting point here is that the subscapularis helps to stabilize the front portion of the shoulder joint. And what we found in the medical literature is that if we have subscapularis specific damage, a lot of times that's coupled with biceps pain. Okay, so if we're not getting good support anteriorly, that might be stressing the biceps as well, which is interesting to me. So again, this could be worsened and caused by soft tissue restrictions. So if my path of least resistance is through the capsule and I have stiff soft tissue, then what ends up happening is I move more through the capsule. And over time, again, this is a feed-forward mechanism. We have more looseness, so we don't have stability within the shoulder joint. We have more motion and then potentially more pain, right? Again, this can be coupled with compensation. Let's say that I have stiffness within the anterior delt, stiffness within the pec. I go into the bottom of a dip. I don't have the range of motion to get as deep as I need to, so I have scapular anterior tilt, and that ends up compressing the rotator cuff and the biceps, right? And then what ends up happening is that we drive out of the bottom of the hole using the thoracic spine and the scapula in order to gain some power out of the bottom of a dip. And again, we have compensation if you have any looseness within the capsule, if you lack the strength and stability. All these things can go together, potentially cause increased wear and tear on some of the structures that end up getting irritated in subacromial impingement syndrome, right? And the last bit, we already hinted to this, is that if I'm fatigued, right, and I have a decreased strength and stability already of the shoulder joint, and let's say that I have more load in my program than used to having in the past, I couple this with poor technique, having increased reliance on the anterior shoulder capsule for support in a dip, right, and this is just going to be setting myself up potentially for an injury, all right?